everybody, this is Dr. Tim Newton with Inspire Movement Physical Therapy. Today we're going to show you how we treat segmental restrictions in the lower thoracic spine. This is a big one. There are many issues that can trace their roots to restrictions in this area, and we don't even think about it because we don't get pain in this area very often. Issues like shoulder pain, hip pain, low back pain, sacroiliac joint pain, pelvic pain, knee pain, foot and ankle pain, the list goes on and on. It's a very important area to address. We usually need to address it before we address anything else, so let's get to it. Let's show you how it's done. Alright, so we're going to show you now how we do a pre-treatment assessment. One thing that's really important to check out before we treat the lower thoracic spine, since it is so integrated with everything, is hip mobility. It's a good gross assessment to let us know if we're making any progress with our treatment or if we need to look elsewhere. So, just to move the legs a little bit here, we have the patient lying on her back. You just take the leg and ask the patient to relax. I just bring it up until I start to feel a little bit of resistance. I can take this farther, but at that point, it's no longer the hip itself that's doing the movement, it's the low back that's starting to wind up. I'm not interested in that right now. I just want to see the hip movement itself. There are a lot of different muscles that connect to it, and those muscles are dictated by segmental health in the low back, which is the lumbar spine, and the lower thoracic spine right above it. So here for hip flexion, we can see she gets up to, if this were 90 degrees of hip flexion, she goes a little bit beyond, maybe to about maybe 110 or something like that, before things start to wind up. Check hip internal rotation and external rotation. I'm just taking mental notes of what that looks like there. Again, we always want to pre-test and post-test to see if our interventions are doing anything. And we always compare both sides. Now her right side moves a little bit better, as you can see. So she stops right about here. If this were 90 degrees, she probably has another 30, maybe even 35 degrees. Okay, so you're saying that's 120 or 125 degrees of hip flexion there. That's the big thing that I'm interested in, is hip flexion. Okay, internal and external rotation. Similar to the other side. The big difference was in hip flexion, so we'll take a look at that as well. Okay, so here we are. We're going to start assessing the lower thoracic spine. This area is very important to treat and assess, and unfortunately, it may be the most commonly overlooked area in our body. We're talking about this area right here. It is the keystone of the body, that along with the upper thoracic spine here. Everything in the hips, low back, legs are all connected and related to this part of our body. Okay? Hips can get tight, you can have knee pain, you can have low back pain, all kinds of things, and it all starts here. So we need to make sure that we can assess it properly. All right, let's have you sit up nice and tall. So the first thing that I'm doing is I want to get a sense for how it all sits in extension when she's upright. Okay, and just to get a reference point, I start down low at her sacrum, okay, and then I move right on up to the lumbar spine. There are 5 segments in the lumbar spine. And what I'm doing here is I'm just feeling on either side of the midline, and I'm seeing, okay, do my thumbs sit evenly, or is there a twist one way or the other? If there seems to be a twist, that indicates that there could be a restriction at that level, and that's a clue as to where we want to direct our treatment. All right, so we're just working our way up, and we compare level to level. Do the thumbs sit the same on the level above compared to the one below? If they're one way here and then the next way they're like that, that gives me, like I said, a clue that there was something wrong there. Now we want to see how well she does in the slouched extreme of things. So go ahead and slouch down, chin to chest. All right, now I'm seeing how well do these vertebrae want to bend forward. Again, I start at the sacrum just to get a reference point. And I work my way up. Sit up nice and tall. Okay. And something changes as she sits up tall right here at this segment. So that tells me that something alignment-wise isn't doing what I expect it to do. I expect both sides to move the same, but instead I'm seeing this as I follow that segment. So this is where we're going to look for our next part of the assessment, which is the motion assessment of the treatment. Okay, so we just showed you how we check things positionally up and down the spine using our thumbs and getting a sense for where there's a rotation. Now we're going to actually get in there and feel how these vertebrae move. And we do that by feeling with the hand along the spine. Okay, this is that lower thoracic region. This would be upper thoracic, and below it would be lumbar, right? So we're checking in here. We're going to feel how things move. But since we need to get in really close, we always want to give the patient a barrier here. So we use a pillow and ask the patient, go ahead and hold on to that. And with your left hand, I would like you to grab your right shoulder, okay? And we can kind of reposition the pillow there. So now I come underneath her arm with mine, like this. So that way I have control of her because I'm going to be moving her around. She's trying to relax and go with the flow. All right, so I start right around T6, T7, and we just work our way down, palpating as I have her move. I want to have her upright when I'm doing motion assessment, and I also want to have her slouched at a different time of motion assessment to make sure we get all pieces of her mobility assessed. So now she's a little more upright, she's a little more extended, so I'm going to start moving her around. And I bring her side to side. All right, you just relax. And I just feel at each level, I'm feeling with these fingers how things move. And we like to do this because this is a very specific way to assess how she's moving. I'm not pushing too hard, but I am shifting my weight just a little bit forward and back. I'm just comparing each level as I move up and down. How do they move? Okay? And she has something in here that doesn't want to come this way very well. So I'm making a mental note of that, but I also, like I said, want to check her in a more flexed position because I want to see how well she can bend forward. So we're doing the same exact thing. Shifting side to side. I'm assessing for the ability of her to glide toward me. Okay? In the clinic, I would do this on both sides. I would go around the table and do it the other way too. But for the purposes of this video, we're just going to show you this one direction. All right. So when she's more flexed, it doesn't seem as restricted as when she was more upright, so that's where we'll do the treatment. So we're going to just continue right into the treatment here. We've got her upright a little more now. And I want to just make sure I've localized and found that segment that was tight. Okay, right in here. So what I feel for is where, relax here, just kind of go with me. I feel for where it starts to bind, and it's binding already. I really can't bend her much at all. So right here in this position, I'm just going to just twist her a little bit and ease the tension on this area. I don't want things to lock up and get all spastic on me. And then I ask her to go ahead and push down gently with her elbow into my arm and hold that. Good. Let that go. And then we are going to see how far she goes now. Okay, she's going a little farther. Gently push down again. So that's all we're doing. I'm focusing right on this very specific segment in a very specific direction. Relax. I'm having her use her muscles to contract and then relax. And once they relax, it enables me to take that specific segment here a little bit farther. Push down again. She's pushing down with her arm, but she's actually engaging these muscles of the spine and trunk that are holding her tight. Relax. They're holding her tight, and then when they relax, I'm able to take the joint into a new position where it had not been able to go before. That's the goal of the treatment. All right, we're going to a bit more, challenge her a little bit. One last time, push down and relax. Okay, so I'm not really able to take her much farther, so I would call that treatment complete. I would say that that was a successful treatment. We always want to reassess, so we're going to do that in just a moment for a muscle energy technique at the lower thoracic spine. Okay, so we just treated the lower thoracic spine, but no treatment would be complete without a reassessment. We can't be going blindly through a bunch of different techniques. We need to make sure that they're actually working. So we had noted before that this left hip had about 110 degrees of hip flexion, so we always want to recheck that and see if it changed. And it's okay if it didn't, but if it did change, then we know that we're on the right track. More mobility is always good for musculoskeletal issues. All right, so she's going, and probably right about here she's stopping. So to me, I would say, you know, if this here were 90, she has another 30, probably about 30, maybe 35 degrees beyond that. So I would say that's an improvement. That takes us to 120, 125 degrees of hip flexion versus the 110 where she was getting stuck right about here. We'll also check the other directions. I think her hip external rotation may be a little bit better, just a tiny bit, nothing super big. And we'll just see if it did anything on the right side. Sometimes this technique can get both sides moving better. This one may be a little bit better, but if it is probably 5 degrees at most, it feels a little bit smoother to me. These rotation directions are about the same. So, again, we would say that this was a successful treatment. We could feel more mobility in the spine after we mobilized it, and we saw a carryover into the hips. We didn't even stretch the hips, but they got looser, just to demonstrate how interconnected everything is and how important that lower thoracic region is for treatment. All right, so that was how we treat segmental restrictions in the lower thoracic spine. If you found this video helpful, leave us your comments, a like, and don't forget to subscribe. Also, check out more videos of ours on our website, marylandmanualtherapy.com. Thank you, and have an inspired day.